Hey guys, so today we're going to be speaking about the pulmonary circulation and a little bit about the pulmonary vascular resistance. So what is essentially the pulmonary system? Pulmonary system is really it's essentially it's a low resistance system. It's a normal to low resistance system. What do I mean by that? If I compare it to the systemic system, which is our blood system is very high. You know, our like I would say our pressure in our arteries is 120 by 80. If I compare it to, for example, a pulmonary system, it's very low. It's like around 15 by, I would say, 8 millimeters of mercury. That's a pulmonary system. So it's generally a low pulmonary, it's a low pressure system or normal to low pressure system. The second thing is that it's high compliance. What does high compliance mean? High compliance actually means less stiffness. Okay, anything that's loose, like maybe you can imagine like a loose like a loose balloon, that's loose. But something that's very low compliance is something very stiff, like you can imagine a very tight rubber band, a very tight rubber band. Okay, so in if over here, if we have in our a decrease in our alveolar oxygen, it is if our oxygen in our alveoli, which is going to be supplying our blood over here. So if you have like an alveoli over here, which is going to be supplying the blood, and we have a decrease in our oxygen. Okay, so what happens over here is that we get this thing called hypoxic vasoconstriction. It will essentially what it means is shifts the blood away from the poorly ventilated areas. So if this alveoli is going to be like low oxygen, we have some nice alveoli over here which are getting really good oxygen. So this our body is protecting us. There'll be some constriction, and that will allow the blood to flow to alveoli which have good ventilation and the ventilated areas of the body. Now there are two concepts that you guys want to learn. It's going to be known as perfusion limited and diffusion limited. Perfusion limited essentially means anyone with normal health, so us, we can qualify for perfusion limited. And basically, your O2, your CO2, and your N2O, okay, which diffuse. So gas equilibrates along the length of the capillary. Exchange can only be increased if blood flow increases. So that means that we have over here a blood vessel, and we have over here an alveoli. And essentially, if there is some issue, the perfusion limited, it can essentially be solved as long as blood coming through. As long as blood coming through, our perfusion will become fine. So that's something we need to keep in mind. Diffusion limited rather is going to be when this can be in people with fibrosis or with emphysema. With O2 and C2, gas is not equilibrated with blood. So no matter how much blood you give it, the gas will not equilibrate. O2 diffuses slowly, while CO2 diffuses rapidly across the alveolar membrane. Disease states that leads to diffusion limitation is going to be fibrosis, which is going to lead to early hypoxia, hypercapnia. Chronic hypoxic vasoconstriction can lead to pulmonary hypertension and cor pulmonale. So we have what diffusion. Diffusion is going to be the alveolar wall thickness, which is going to be times by diffusion coefficient of gas, with the difference in partial pressure. So decrease in decrease in emphysema and pulmonary fibrosis. So diffuse limited capacity of carbon monoxide is the extent to which carbon monoxide passes from the air sacs into blood. So we can see over here the like the partial pressure of O2, and there's going to be equilibration. Okay, and this is perfusion limited. We can see fibrosis. We can see perfusion limited, and we can see diffusion limited. What does this mean? Perfusion limited essentially means that there is going to be it's mainly for oxygen that as you go to the length of the capillary, if you're not increasing the partial pressure, you're not increasing the blood flow. Once you increase the blood flow and the partial pressure, then only the O2 will be equilibrated. Now, in the scenario where there's fibrosis, no matter how much you increase the pressure, there'll really be no point because it is there's fibrosis. The oxygen cannot transfer. Now, let's come to perfusion limited. Essentially the same thing. The perfusion limited is corrected by blood flow. If there's going to be more blood flow, you can increase. And then we can see over here diffusion limited. So PaCO2, as you go through the length of the capillary, more carbon monoxide you go, it's going to be there. The one thing you guys want to know that carbon monoxide, it attaches to RBCs much more stronger than anything else. It attaches like really strong to red blood cells. It immediately attaches compared to oxygen, compared to anything else. Carbon monoxide, it really attaches really, really well. Okay, so we can see over here the pulmonary vascular resistance over here. Pulmonary vascular resistance is going to be essentially pulmonary artery minus your pulmonary left atrium. So essentially, it's saying that your pulmonary artery. So of course, from your right heart, you when you're coming from the lungs, your lungs is going to be over here, and from your lungs, it's going to be going into your left heart, left atrium, for example, left atrium over here with left ventricle. So it's essentially saying this artery over here minus the atrium over here. What's the difference? What's like the pressure gradient? Over that's going to be over the cardiac output. Okay, now remember, change in pressure, which is the same as this, okay? Change in pressure, which is pulmonary artery pressure minus left atrium, is equal to Q times R. So essentially what they're saying, this PVR, they're writing this as R, and this pulmonary artery minus pulmonary atrium, they're writing this as change in pressure, and they wrote over here Q, okay? So now they're making this the subject of the formula. And how do you make this subject of the formula? You essentially bring it over here, and once you bring it over here, you essentially gonna get, you're essentially you're basically going to be getting a scenario where Q comes on this side. So Q comes over here, and then this becomes like the subject, because Q comes here, so it gets canceled out from here. We can cross it out and change of this, which is the formula they mention over here. And of course, you can inverse it, so this will also be the subject of the formula. Now coming into R, resistance. Now what is resistance? Resistance is going to be your 8, which is a factor, times N, which is going to be your viscosity. Okay? Your viscosity essentially is your stickiness, like honey. Honey is very viscous. It's very sticky. Water is not very viscous. It's like it flows. Okay? Times the length of the capillary. Why the length of the capillary? Well, I have mentioned it over here in the notes that basically the length of the capillary, the more the length of the capillary, there's going to be more friction. The more the length, there's going to be much more friction. And because there's going to be much more friction, we are going to be getting much more resistance, of course. So the two factors for resistance are going to be 8 times viscosity times the length of the capillary. Now, this is going to be over what? And these are going to be any factors that kind of would decrease resistance, okay? It would be your radius, okay? So radius to the power of 4. Now, why radius to the power of 4? Because radius is such an important factor with the resistance. Imagine you have a small vessel. Your resistance is going to be skyrocket. If you have a big vessel, your resistance will be very low. So this is a really important factor, and that's why it's inversely and to the power of 4, because that's how important of a factor it is. Let's do some questions. In a healthy individual, a resting individual, which of the following best describes pulmonary gas exchange for O2 and CO2? So that's going to be your perfusion limited. It's in a healthy person. We were going to get this. How does pulmonary vascular react to low oxygen levels, hypoxic? So a vasoconstricts, no. A vasoconstricts, that's going to be correct. Which of the following conditions is most likely to cause early hypoxia due to diffusion limitation? Well, early hypoxia exercise not necessarily to diffusion. Chronic bronchitis, not, it's going to be more fibrosis. Remember, if we draw alveoli and we draw over here blood, we're going to be getting some fibrosis over here, which is going to lead to diffusion problems. Why is CO2 less than O2 to be affected by limitation in disease states? So O2 is less likely because O2 diffuses more rapidly. It's a much more rapid diffuser. According to which of the following, pulmonary vascular has the greatest vector resistance? That's going to be radius. It's affected the most. If a patient with a decreased DLCO, diffusion limiting causes, that suggests that there's going to be increased blood flow, no. Impaired transfer of gas, that can be possible. Increased pulmonary component, no. Improved validation, no. It's going to be this. It's going to be across the blood. All right, guys. So that was a little bit about the pulmonary vascular resistance and the pulmonary circulation. Just to give you guys a quick recap, that it is a low pressure system, high compliant. Perfusion limited means it happens in normal people. So that essentially means that your blood will come and help you. Diffusion limited happens in sick people with emphysema, and that means that your only some things flow fast and some things do not flow fast. Pulmonary vascular resistance is basically the change of pressure, the pressure from the artery all the way to atrium over the cardiac output. And this can also have another formula over here for resistance, which is going to be very much affected on your length of your capillary because of friction forces, viscosity, which is your stickiness, which is over your radius of the whole artery. So guys, hopefully you found this video useful. Thank you guys so much for watching, and I hope to see you guys next time.